HIV/AIDS in Taiwan. Taiwan's epidemic of HIV/AIDS began with the first case reported in December 1984. On 17 December 1990, the government promulgated the AIDS Prevention and Control Act Chinese, 后天免疫缺乏症候群防治条例. On 11 July 2007, the AIDS Prevention and Control Act was renamed the HIV Infection Control and Patient Rights Protection Act Chinese, 人类免疫缺乏病毒传染防治及感染者权益保障条例. As of March 2016, there are 31,620 reported cases of Taiwanese testing positive and 1,020 foreigners testing positive. Until January 2015, the original HIV Infection Control and Patient Rights Protection Act required foreigners who tested positive to be deported. Therefore, most of the reported foreigners are no longer in Taiwan. This policy was repealed in January 2015, allowing HIV/AIDS infected foreign individuals to remain in Taiwan. HIV/AIDS patients' medical treatment costs are covered by Taiwan's national health insurance in HI. Epidemiology. The first reported case was reported in December 1984 on a foreign transit traveler. The first local infection was reported in February 1986. According to the statistics of Taiwan's Centers for Disease Control, as of 6 February 2014, there were 26,646 cases of Taiwanese becoming infected with HIV. Of all cases, 93.39% are male, 6.61% female, 72.24% are 20-49 years old, 20.8% are 15-24 years old. Another 893 foreigners have tested positive, most of whom have been deported by the Taiwan government before the policy change. The CDC has not published an analysis of foreigners who tested positive. The ratio of patients of drug users increases rapidly. Since 1984, incidence of infections through sexual contacts had accounted for 90% of all cases for most of time. But in 2005, drug-using patients accounted for more than 50%. To prevent the disease from spreading to general population rapidly, the CDC announced the harm reduction pilot projects for IDU. The program includes expansion of the existing education and rehabilitation network, and the establishment of a harm reduction program unprecedented to the country. 1. HIV-1 epidemic. Taiwan is entering a new and dangerous phase of its HIV-1/AIDS epidemic, which by far accounts for the majority of its total number of HIV infection cases. By the end of 2006, 13,702 individuals, including 599 foreigners, had been reported as infected with HIV-1 to the Centers for Disease Control of Taiwan. In 2003, HIV-1 rates in first-time blood donors, military conscripts, and pregnant women were measured at 5.2, 57.0, and 12.0 per 100, respectively. Data from that year indicated HIV-1 rates of 0.9% for intravenous drug users, 0.2% for female sex workers, 1.9% for patients with sexually transmitted infections, and 6.7% for men who have sex with men in saunas or bathhouses. Since then, the number of people living with HIV-1/AIDS in Taiwan has jumped sharply, from an 11% increase in 2003 to a 77% increase in 2004 and a 123% increase in 2005. However, after the implementation of a harm reduction program, a 10% decrease was seen in 2006. The current estimated number of HIV-1/AIDS cases in Taiwan is about 30,000, which suggests that the infection rate there could be greater than that in China, 30,000 per 23 million 1/767 compared with 650,000 per 1.3 billion 1/2000. A risk factor analysis of reported cases showed that the proportion of intravenous drug users infected with HIV-1 increased from 1.7% 13/772 in 2000. The most important risk factor for Taiwanese intravenous drug users is needle sharing, followed by the sharing of heroin diluents. A molecular epidemiological study showed that more than 95% of intravenous drug users with newly diagnosed HIV-1 in 2004 and 2005 were infected with CRF7b, a circulating recombinant form of subtypes B and C previously. Several studies suggested that CRF7bc, the subtype, is believed to have moved to Xinjiang in China's northwest along a major heroin trafficking route. Of the 60,000–100,000 injecting drug users in Taiwan, 10–15% may be infected with CRF7bc. If so, they probably represent the largest group of such intravenous drug users in Northeast Asia. The circulating recombinant form might have followed a separate drug trafficking route to Taiwan from Yunnan via Southeast China, Guangxi, and Hong Kong. There have been enormous increases in the amount of heroin smuggled into Taiwan and in the number of intravenous drug users since 2002, when 5 intravenous drug users from southern Taiwan were diagnosed as the country's first HIV-1 seropositive cases infected with CRF7bc. Even though the Hong Kong authorities identified 3 cases of CRF7bc infection in 2001, a serious outbreak in that city's population of intravenous drug users is believed to have been blocked by a methadone maintenance program. Monitoring, control, health care. HIV/AIDS patients' medical treatment costs are covered by Taiwan's national health insurance NHI coverage. In 2011, Taiwan's CDC was considering switching from providing HIV/AIDS treatment for free to a subsidized model. The cost of treatment for each AIDS patient in the country is estimated at $30,000 US $930 per month. In 2013, CDC Deputy Director Chuang-Jen H-Sing Zhuang Ren Xiang said that the rise in the rate of HIV/AIDS cases was outstripping public funds and that the NHI was in $600 million US $2 million in debt due to treating HIV/AIDS patients. Chuang added that the Ministry of Health and Welfare was still considering a plan to reducing coverage for HIV-positive Taiwan nationals from their current full coverage, in addition to requiring foreign nationals to pay in full for their treatment. Other STI and illnesses were covered under national health insurance during this time of debate. Criticism of reducing coverage and expecting HIV/AIDS-related treatments to be paid by the individuals included that it further promoted the faulty idea that HIV/AIDS contraction is the fault of the individual. Organ transplants. Currently, HIV/AIDS patients are eligible for organ transplants. Plans exist to allow HIV/AIDS positive patients to donate organs to other HIV/AIDS positive patients by the end of 2016. Until March 2016, HIV/AIDS patients were ineligible to receive organ transplants, including transplants of the heart, lungs, liver, kidney, pancreas, cornea, and small intestines. Responses. Several positive responses to the HIV/AIDS epidemic in Taiwan should be mentioned. Since 1992, 16 non-governmental organizations registered or established in Taiwan have provided shelter, care, counseling, anonymous testing, and AIDS education. One in particular, the People Living with HIV/AIDS Rights Advocacy Association, has been addressing human rights issues related to HIV/AIDS since 1997. However, most such organizations have their headquarters and facilities in northern Taiwan, and 2/3 of the country's intravenous drug users live in central and southern parts. In addition, many social workers employed by non-governmental organizations are still unfamiliar with issues related to drug abuse and inexperienced in interacting with intravenous drug users. There is a clear and immediate need for counseling workshops for medical staff and social workers. In the long term, there is need for more funding for AIDS research, especially vaccine development. Society and culture. Stigma. While Article 6-1 of original 1990 AIDS Prevention and Control Act stated that HIV-infected individuals shall not be discriminated against, nor shall they be deprived of their rights, a lack of specifying what those individuals' rights were left many loopholes open in the interpretation of the Act. In addition, the Japanese-era 1944 Communicable Disease Control Act contained articles that could be used to circumvent the protections intended by the 1990 AIDS Prevention and Control Act, particularly Article 35 and Article 40. Some institutions would cite the 1944 Act as a legal defense for discriminatory practices, including a school which turned away a student. When communicable diseases occur, or are expected to occur, local competent authorities may impose restrictions, prohibitions, or other adequate measures on farming, husbandry, swimming, or drinking water of certain area under their jurisdiction. When necessary, they may request various central enterprise competent authorities for assistance. When medical personnel other than physicians, in the course of their duties, detect patients, suspected patients, or the remains that they consider to have been affected by communicable diseases, they shall immediately report such cases to physicians or to competent authorities of the locality in accordance with regulations of paragraph 2 of the preceding article. Medical institutions shall assign a full-time person who is responsible for the supervision of subordinate medical personnel to ensure the regulations of the preceding paragraph or the preceding article are followed. As the HIV-1 infection threat increases, there are many signs of persistent denial and resurgent discrimination in Taiwan. Several important issues need to be addressed: sentinel surveillance of female sex workers, economic impact. The original 1990 AIDS Prevention and Control Act did not explicitly protect the right to work and had no penalties for refusing employment to HIV-positive people. Work discrimination in Taiwan became common, with even some state-run enterprises and government agencies requiring mandatory HIV blood tests. Examples of discrimination include the discharging of a Taipei police officer in 2001, the laying off a healthcare worker in 2002, and a Taipei metro driver who came under pressure and gave up his job. Infected foreigners and human rights. Identification of HIV/AIDS positive foreigners usually occurs during mandatory blood test for teachers, government agencies' workers, and some state-run enterprises' employees. There are no penalties for enterprises refusing to hire a foreign person carrying HIV, thus allowing work and employment discrimination. 1990 AIDS Prevention and Control Act. Amendments. The AIDS Prevention and Control Act was amended 6 times before it was renamed the HIV Infection Control and Patient Rights Protection Act in 2007. After its renaming, the act was further amended. In 2004, Taiwan's Department of Health proposed a revision that would allow foreign HIV carriers to stay in Taiwan for less than 14 days, without restricting the number of times they can apply. The revision came under criticism by patient groups and health experts as being only a small change that did not address the central issues of human rights and the lack of evidence showing a link between deportation and decrease. Eventually, the revised Article 18 of the HIV Infection Control and Patient Rights Protection Act allowed deported foreign nationals to apply once per quarter for a short-term visa that lasted no longer than 14 days. Deportation requirement lifted. On January 20, 2015, the Legislative Yuan passed an amendment that repealed the requirement for foreign nationals diagnosed with HIV/AIDS to be subject to deportation. However, foreign residents are subject to additional barriers from treatment. In addition to being a legal resident, joining the NHI after staying in Taiwan for a minimum of 6 months, and having their HIV status confirmed by a hospital, Foreign residents are required to pay the full costs of their HIV/AIDS treatment for 2 years, after which the costs will be covered by the NHI. The CDC estimates that 2 years of treatment costs approximately $20,800.